Hi, I'm still Dr. Paul Howard, a board-certified plastic surgeon in Birmingham, Alabama. Welcome to my Faceliftology video blog. Today we're going to talk about neck lifts. On our website we get a lot of requests for neck lifts, double chins, turkey gobbler necks, you name it, there's a name for it, and neck lift is the treatment for it. I'm going to talk about neck lifts in the realm of doing facelifts. Neck lifts are probably the second most common procedure that we perform at the same time that we do a facelift. If you notice in some of the recent results, some of the shorter scar facelifts that are done out there do less work with the neck, and the neck suffers a little bit from these procedures. We don't think that's true with our procedure, as we spend a lot of time perfecting the neck lift portion of the operation. Basically, the way it works is that the neck has basically three components that are problematic. One is the skin becomes lax, and as you get older in the lax skin, and if you have a fullness in your neck, it stretches the skin more. So you've got a lot of skin laxity. And no matter what kind of laser procedure, smart lipo, smart laser, dumb laser, it doesn't matter. If you try to take the fat out and shrink the skin when it's like this, when it's aged skin, it generally leads to disasters. So one, we have to take care of the skin, and usually that'll be in terms of tightening it, and we'll discuss that in a minute. Second part of the neck lift is fat. Some people don't have any fat in their necks, and that's very nice. It's known that people that have a little fat in their face and fat in the neck actually age slower than people who have thin necks and thin faces. But regardless, if you've got a thin neck, what that shows is your bands. And the bands in the neck are basically the platysma muscle, which is a normal muscle in the neck that acts like a sling across the neck. And when we get older, the sling separates in the middle and the muscles contract and they cause bands, usually 2 or 3, toward the midline of the neck. If you don't have any fat, they're easy to see. If you've got fat, they're still there, and you uncover them after you take the fat out. So we've got skin, we've got fat, and the last thing is this muscle, the platysma muscle. Because of the bands having separated, we need to reconstruct the muscle by suturing the bands or suturing the muscle together back in the midline. This tightens the muscle all the way across the neck and creates a nice sling for the rest of the reconstruction. So if you don't tighten the muscles and deal with the bands, you'd never get a nice front neck. We do this through a little incision in the submental area of the neck, approximately 1 inch long. Through this incision we can fix the muscles and take out the fat. The skin is done through the facelift incision, and basically you can look at that as the skin of the neck is pulled tight from behind the ear. So the incision behind the ear pulls the neck skin tight. As you tighten the SMAS laterally with the facelift procedure, it works with the platysmal tightening in the midline to tighten the neck in its full extent from ear to ear. And then you re-drape the skin so that it's nice and smooth. Take the fat out so there's no extra fat, smooth muscles, and that's what we call a neck lift. Thank you for joining us today for the Faceliftology blog, and we hope to see you on our next edition.